Now, Jim Chesebro and Dr. Frank Sachs, professor of medicine at Harvard Medical School and professor of nutrition at Harvard School of Public Health in Boston, Massachusetts, discuss nutrition to prevent vascular aging.
Welcome, Dr. Sachs.
Thank you.
Maybe you can describe what are the contents of this nutrition that help prevent cardiovascular problems.
As people get older, they lose nephrons and their kidneys are less able to excrete the sodium that they take in their diet. So they're more sensitive to the blood pressure raising effects of sodium. And in addition, there's increased vascular resistance peripherally due to reduced endothelial function, and there's increased stiffness of the large conduit arteries like the carotids or the aorta. So those are the problems that lead to systolic and diastolic hypertension. And what's been found in the past 5 to 10 years, a good lot of research that shows that improving the diet actually improves the function of the large conduit arteries. Like it improves the compliance, it reduces the stiffness of the carotids and aorta. And for that reason, it really makes an older person's artery more youthful, like a younger person's. And an older person's artery really is less able to accommodate the increased blood flow caused by higher sodium, or really just by normal blood volume. So if we really reduce sodium, and if we change to a more healthy diet pattern, like a Mediterranean pattern, we really can actually improve these basic processes of aging and make our vasculature more youthful.
That makes a whole lot of sense and is, I think, in better defining from age 30 to 80, renal function is cut in half, even though the creatinine level stays the same, and that's why we calculate a GFR related to age to help. And all that makes sense that at age 60, about half of people have hypertension, and it goes even higher as people get older.
Absolutely true. And what's amazing is how much it can be improved by changing diet for a month, for example.
And also, we know that obesity contributes to elevated blood pressures, too.
Yes, this is true. Actually, obesity adds to the effect of high salt or effect of a bad diet. Weight loss improves the arterial stiffness, and weight loss also improves endothelial function by measurements of nitric oxide or the effects of nitric oxide.
So what is the new American Heart Guidelines is that people limit their sodium to 1,500 milligrams per day. Is that correct?
Yes, that is correct. 1,500 milligrams per day is the amount of sodium in what we find is the most healthful dietary pattern, a diet that's like a Mediterranean diet or a DASH diet, a diet that's high in fruits and vegetables, high in low-fat dairy, high in fish, beans, high in unsaturated oils, high in protein, reduced in carbohydrate. All those things contribute to blood pressure lowering properties of an optimal diet. So you take that and you reduce the sodium on top of it to 1,500, you really get a tremendous reduction in blood pressure, like stage 1 hypertension, 15 millimeters mercury reduction. That's as much as several drugs can do in a controlled design.
That's so important to try to emphasize to our patients. And the healthier diet also in preventing the abnormalities of the cholesterol profile, too, that also assists.
Well, that's right. I mean, the diet that, like a Mediterranean diet, it raises HDL, it lowers triglyceride, it also lowers LDL, and it improves insulin sensitivity. So you get all of those benefits across the whole risk factor spectrum.
How do you work it out with your patients? You have a dietitian talk with them?
What's really been found these days, I'm sorry to say we don't do it quite right for various reasons, is that patients need ongoing follow-up. There's some new programs that do that remotely, by internet, for example, by email, so the patients don't have to come in frequently and incur costs of a one-to-one visit with a dietitian, the inconvenience, the time off from work, and they can do all this at home. So just purely remote counseling can accomplish that. So, doctor, we would see patients and we would recommend them to a program that can do that. I mean, there are other programs around that have actually published trials of their effects on diet change, like Weight Watchers and Jenny Craig, for example, Healthways, and they do a good job. Going to those programs causes more persistence of the improvement in weight loss or improved diet quality.
So there's more than one approach, and it's getting into whatever the patient finds most convenient, but the importance, as you point out, is the regular follow-up to make sure they're adhering and doing the right thing.
Exactly. There are some really independent-minded people, and if they just get the advice they need, they will go out and just do it, and they don't need follow-up. They are a tiny minority. Most people just need more attention, reminding, some feedback, especially when the doctor can send a message, oh, I saw your weight, you're doing great, or you haven't logged in very much to this internet system. So come on, let's get you thinking about weight loss and improving your diet. That's actually really effective when the doc gets a bit involved, just a little bit involved, and it goes a long way.
And then we all got to work together, all the physicians caring for the patients, so we all give them the same message is very helpful too.
This is totally true. And those programs can be brought into clinics and hospitals. I think now that we understand that they actually really improve patients' optimization of their diet and the persistence of diet change, I think we'll see much more of that happening.
And then we also have to be aware that when the patient is obese, that we ask them the 2 nighttime questions of, do you snore at night and do you wake up tired? And if so, they should be evaluated for sleep apnea, which can be reversed as they lose weight.
Yeah, absolutely. Sleep apnea can be also type 2 diabetes, if it isn't too far gone, can be cured by weight loss, and same with hypertension.
Okay, well, this is an excellent discussion of the contributions of diet to many of the cardiovascular risk factors here, and helping just with diet to markedly improve these risk factors and their control. And I thank you very much for coming to discuss this with us.
Thank you for the opportunity.